Welcome to the Padda Institute. I am a physician with over 30 years of clinical experience in anesthesiology, interventional pain, metabolic health, and addiction. I also approach the practice of medicine with the analytical mindset of an entrepreneur who has operated dozens of healthcare businesses. At the Padda Institute, we operate under a foundational belief that is increasingly rare in the modern medical landscape. Pain is not a diagnosis, it is a signal. It is an alarm from your body indicating that something in your structure, metabolism, or nervous system has drifted fundamentally out of balance. Today we are discussing the complexities of low back pain, leg pain, and the condition often referred to as sciatica. Our goal is to move beyond the assembly line model of care and provide you with a deep, data-driven understanding of why standard treatments often fail, and how we intervene intelligently to fix the underlying terrain. St. Louis is a hub for world-class medical care, and the Padda Institute is proud to be part of that tradition. Our facility is conveniently located near Lambert St. Louis International Airport, which makes us a true gateway to relief for patients traveling from across the country or the globe. We have designed our consultation and procedural workflows to be exceptionally efficient, minimizing your time away from home while maximizing the clinical depth of your evaluation. When we talk about low back pain and sciatica, we are usually describing a signal that originates in the lumbar spine. Sciatica occurs when the sciatic nerve, the largest nerve in the human body, becomes compressed or inflamed. This often manifests as a sharp electric or burning sensation that radiates from the lower back through the buttock and down the leg. The standard medical response to this signal is often a rapid escalation towards spinal surgery. However, I am going to provide a contrarian viewpoint that many surgeons are reluctant to share. Back surgery is not a guaranteed cure for pain. From a scientific perspective, surgery is primarily a structural intervention. It is designed to improve spinal stability or to prevent catastrophic neurological deficits, such as the loss of bladder or bowel tone, which is a true surgical emergency. While surgery can be highly effective at decompressing a nerve and preventing permanent paralysis, it does not seem to improve chronic pain levels in the long term for a significant portion of the population. The statistics are sobering and merit a deep analytical review. According to research published in the journal Pain, the incidence of what is known as failed back surgery syndrome ranges between 20 and 40%. This means that up to 4 out of every 10 patients who undergo back surgery will continue to experience persistent pain or even worsening symptoms after the procedure. Furthermore, a study in the Journal of Bone and Joint Surgery indicated that the reoperation rate for patients undergoing lumbar discectomy can be as high as 15% within 5 years. For many, the surgery addresses the plumbing of the spine, but ignores the electricity of the nervous system. At the Padda Institute, we believe that if we can identify the specific signal precisely, we can often avoid invasive spinal surgery. This is where selective nerve root blocks, or SNRBs, become an essential diagnostic and therapeutic tool. In an SNRB, we use high-resolution fluoroscopic imaging to guide a needle to the exact exit point of a specific nerve root, such as the L4, L5, or S1 nerve. We then deliver a precise mixture of anesthetic and anti-inflammatory medication directly to that nerve. This is not a vague or shotgun approach to pain. It is a targeted diagnostic test. If we numb a specific nerve root and your radiating leg pain disappears instantly, we have identified the primary generator of your pain signal. This precision allows us to develop a non-surgical plan that is data-driven and outcome-focused. We use the information gained from these blocks to intervene intelligently, calming the hyper-excitable nerve and allowing the body to begin the healing process, without the trauma of a major surgical incision and the subsequent risk of scar tissue formation around the nerve. However, we must also address the biological reality of the terrain. Structure is only one piece of the puzzle. We do not believe that pain can be sustainably treated without addressing metabolic health, inflammation, and nervous system regulation. This is the part of the conversation where I must bring humility to the table. No injection, no matter how precise, can overcome a pro-inflammatory lifestyle. Science tells us that chronic pain is often exacerbated by systemic inflammation. If a patient is struggling with insulin resistance, poor sleep architecture, or chronic stress, their nervous system remains in a state of high alert. This lowers the threshold for pain signals to reach the brain. If your metabolic house is on fire, the volume knob on your pain signal is turned all the way up. A study in the Lancet Rheumatology has shown that metabolic dysfunction and obesity are significantly correlated with increased sensitivity to nociceptive signals. We reject the assembly line model that simply performs procedures because insurance allows them. Instead, we work with you to rebuild the terrain. This involves a physician-led focus on stabilizing blood glucose, optimizing nutrition to reduce oxidative stress, and regulating the autonomic nervous system. When we combine precise interventional blocks with a rigorous focus on metabolic health, we create an environment where the body can actually resolve the signal of pain rather than just masking it. For those of you who have been told that surgery is your only option, or for those who have already had surgery and are still suffering, I want you to know that pain is a signal, not a sentence. You do not have to settle for a life of persistent disability. Our team in St. Louis is dedicated to providing a seamless, efficient, and deeply analytical experience for every patient. Whether you are flying in from another state or driving from across town, we are your gateway to relief. We invite you to explore the resources at www.painmd.tv to learn more about our philosophy and our approach to modern interventional pain management. We bring 30 years of experience and a deep belief that every patient deserves a precise diagnosis and a comprehensive plan to fix the underlying causes of their suffering. Thank you for your time, and we look forward to helping you reclaim your health at the Padda Institute. Medical disclaimer: this content is for informational purposes only. For medical advice or diagnosis, consult your personal medical professional.